Right now, just breathe normal, okay? Aortic. Pulmonic. Erb's point. Tricuspid. Here, lay back. And mitral. Okay, now I want you to take deep breaths for me. Here, scoot up just a little bit. Just take deep breaths in through your nose. But keep your mouth closed for me, okay? Raise your arm just a little bit. Deep breaths. Okay. Raise this arm for me. This way, just a minute. Okay, just sit up straight for me. Deep breaths. Deep breath. Okay. One more. Okay. Turn back around. Do you have any pain? Are you in any pain today? 0 being none and 10 being the worst pain of your whole life? 0 pain. Okay. Do you have any abdominal pain? Okay. Lay back for me. Let me look at your stomach. When was your last bowel movement? When did you poop last? Today? Was it hard or runny, or can you tell me? I mean, was it your normal? Normal. Okay. Was it a lot? Do you go often? When
Her chest is symmetrical. There are no abnormalities. On my stethoscope. I'm going to clean off the stethoscope and take a listen to your heart sounds and lung sounds. And with heart sounds, I am going to listen at the left intercostal space, mid-clavicular, fifth intercostal space down. You can just sit and relax. I'm listening for a full minute to the apical pulse, listening for rate and rhythm. So after a full minute, I've heard regular rate and rhythm, and now I want to listen to your lung sounds. And patient has a nice, steady and even respiratory rate. So I'm going to go down maybe into that second or third intercostal space and have the patient take a nice breath in and out with her mouth open. Very good. And then slide it down maybe into more like the fourth or fifth. Very good. And then posterior chest, I'm just going to have you turn around. Avoiding the scapula and the vertebrae, I'm going to start at the back, nice and easy, in and out. It'll be 10 landmarks. Very good. Those lower lobes. So lungs are clear in the anterior and posterior chest. I'm going to have you lay down and take a look at your belly. Okay. So abdomen is flat. When was the last time you urinated?
Today.
And did you have a bowel movement today?
Yeah.
Passing gas? Yes?
Yep.
Okay. So on inspection, there are no tattoos, piercings, striae, bruising, no problems there. Then I'm going to listen before I palpate and listen in all four quadrants. She's got normal bowel sounds. Very good. Then I'm just going to lightly palpate your abdomen. Any tenderness, any pain where I'm palpating?
No.
Okay, good. Very good. So,
Okay, or any tenderness. You lift up your breast, please. Any soreness?
No.
Okay. I'm going to listen. I would like you to take a deep breath, and I'm going to go slow. No, not right now. Just when I go to listen, just take a deep breath for me, but I'm not going to rush you. Okay? No, I'm just going to have you flip around and I'm going to listen to your back. Okay, I'm inspecting your back. I'm just looking for any lesions. I'm looking for symmetry. Any bony deformities, I would also check in the front for those as well, and in the back. I'm going to palpate your back. I'm just going to touch, let me know if there's any tenderness. Any tenderness? Anything?
No.
Okay, I'm just going to percuss, which means I'm just listening. Anything abnormal? Okay, I also wanted to say that if I found anything abnormal, that I would also do a test for bronchophony, egophony, and a whisper pectoralique testing as well. I'm just going to have you say 99. I'm going to place my hands in your back.
99, 99, 99, 99, 99, 99.
Okay, I'm going to listen. Again, just take deep breaths, but I'll go slow. Okay. I'm going to check for thoracic expansion. So I'd like you just to take a deep breath for me. Okay, great. I'm going to check for CVA tenderness. Just going to put right here. Feel any pain?
No.
Feel any pain?
No.
Okay, great. All right, I'm going to have you turn around. I'm going to listen to your heart and your lungs. I'd like you to lie down. Or your heart and your vessels, sorry. You okay? All right, I'm going to be checking your 5 assessment areas. My goodness, sorry. I'm going to be checking, there's 5 of them. There's your aortic area, which is located your second intercostal space, right sternal border over on this side. Then there's the pulmonic area, which is second intercostal space, left sternal border. Your pulmonic area is the second intercostal space. Your third intercostal space is your Erb's point, which is left sternal border. Your tricuspid area is fourth intercostal space, left sternal border. And then your mitral area is fifth intercostal space, midclavicular line. I'm also going to listen to S1 and S2 sounds. S1 is due to the closure of the tricuspid and mitral valves, and S2 2 is from the aortic and pulmonic valves closing. I'm going to check for systolic and diastolic murmurs. Systolic occurs after S1. Diastolic occurs after S2. And I'd also like to say that if I listened and found anything abnormal during this exam, that I would have you either sit up or move to your left lateral side, which brings the heart closer to the chest. So the first thing I'm going to do is I'm going to be inspecting your chest area. I'm looking for any pulsations. I'm looking for any heaves, any lifts, any vibrations. I'm going to palpate your area, again feeling for pulsations and vibrations. I'm just going to... Okay, no pain, no tenderness in any of those areas.
No.
Okay, now I'm going to listen with my stethoscope. Okay, I'm also going to be listening to your temporal arteries, which are up here, and your carotid arteries, which are in your neck. Can you take off your glasses, please? Okay, then we'll be checking your pulses. Again, I'm going to check your temporal. Carotid one at a time. Okay, now we're checking your brachial pulse. And your radial. Okay. Now let's hold your popliteals right behind your legs, behind your knees, I mean. Okay. Okay, your dorsalis tibius is located at the top of your foot. And your posterior tibialis is located behind your ankles. Okay. You drink of water?
I'm good.
The next thing I'm going to do is I'm going to be assessing your abdomen. I'm just looking for the contour of your abdomen. I'm looking for any peristalsis. I'm looking at the position of your umbilicus. I'm looking for any lesions, anything like that. I'm going to listen to your abdomen. I also want to go back, and I just remember that I had forgotten to listen to the bell part of my the bell part of my stethoscope. So I'm going to listen to your heart one more time. Now that I listened, I'm just going to feel for your abdominal aorta. Okay, now I'm just going to touch your stomach. Let me know if any of this hurts. Do you have any pain or tenderness? No? And I'm going to go a little deeper. Let me know if there's any pain. Okay, I'm going to have you take a deep breath. I'm going to put my hand under here. And one hand right here. And I'm just going to have you take a deep breath and hold it. Okay, can I go? I'm going to check down here. Okay. One more time. Over on this side. Deep breath. Okay.